Hi, this is Dr. Diane Hayden, and I am the publisher of Natural Nutmeg Magazine and Essential Naples Magazine. Welcome to my weekly podcast. I'm excited today to have Dr. Michael Duben on with me. He graduated magna cum laude from NYU and attended Mount Sinai School of Medicine. He completed his residency at Montefiore and Mount Sinai hospitals and obtained his endocrine training at the Albert Einstein College of Medicine Montefiore Hospital. He is a clinical instructor at the Albert Einstein College of Medicine, is board certified in diabetes, endocrinology, and metabolism, and has been in private practice since 2003. He finished his functional medicine training in 2024, and he's located in Fairfield at 501 Kings Highway East, Suite 103. And his website is www.restorehealthmd.com. That's spelled RESTOREHEALTHMD.com. So welcome, Dr. Duben. How are you today?
Good. Thank you, Diane. Thank you for having me on your podcast. It's a privilege.
Yeah, so we're going to talk about some cool stuff today. And the first question I have to ask you, because I'm sure everybody watching this is like, what is a functional endocrinologist? I've never even heard of that, which I hadn't either until I met you. So first tell us, how is that different from traditional endocrinology? And how did you get from basically the traditional medical model, going down that path in traditional medicine, practicing as a regular MD? Why did you switch? And kind of just tell us a little bit about that journey.
Absolutely. So, functional medicine as an approach to treating a patient is a wider, so to speak, approach than traditional medicine. Traditional medicine is a part of functional medicine, but the difference is that functional medicine attempts to look and address root causes of the disease, trying to do it always, and not simply manage chronic symptoms. One of the issues with traditional medicine is that very rarely, unless it's something surgical, you remove your appendix, your appendicitis is cured, right? There are situations when the disease is literally reversed. But chronic diseases like diabetes, hypertension, hormonal deficiency are rarely reversed. And moreover, there's usually not even necessarily an attempt to do so. The difference is that you look at a much broader and deeper simultaneously situation that's going on with the patient. You address not only symptoms at hand, but in the entire lifestyle. So, for example, if you're dealing with diabetes, you not only assess the medications, but you take a very detailed look at dietary history. You take a look at various stressors and what can be done about that. Sleep is super important in just about anything in functional medicine because it's such a disruptor. It's such a cause for stress, which then downstream causes a bunch of hormonal disruption. You look at things like habits, exercise, relationships, even spiritual aspects of a person's life, and you try to put it all together in a holistic kind of approach. So you don't simply tweak medicines, but you try to go deeper, and often, not always, but often are able to, if not completely eliminate or reverse a disease, but at the very least substantially improve it. My own personal journey was a slow evolution. Obviously, I'm trained as a traditional, Western medicine doctor, and I am very grateful, for being trained in absolutely wonderful, esteemed institutions. And a lot of people who trained me were people with national and international stature. I learned an incredible amount from them, and I'm forever grateful for the opportunity to work with absolute, giants in the field. But very early on, I kind of started noticing limitations in the traditional approach. I think the first one for me was a huge discrepancy between recommended diet for diabetics, which at the time was this horrible, food pyramid that essentially encouraged people to have all the wrong foods,
right?
Starches and the such. So one of my presentations, actually, fellowship, my training, we had to present very large topics every 6 months, roughly, in front of the entire department. And one thing that you could not do in front of people with probably combined experience literally in centuries, because it would be like maybe 30 people in the room, professors and chairman of the department and program director. And these people knew literature back and forth, and they wouldn't allow you to just BS. You had to be ready. And so each presentation took multiple weeks to get ready to a lot of literature research. In doing so, I mean, even before I started, so my topic was low carb versus low fat diet, because the recommendation for cholesterol is always low fat, low fat, low fat, low fat.
Right.
So I delved into literature, published medical literature on the comparisons of low fat versus low carb diet. And to my amazement, I realized that, well, the recommendations to have low cholesterol, low fat diet, well, definitely for diabetes, this just didn't make any sense. And furthermore, most published literature, virtually all, not literally all, but lion's share of the studies clearly showed benefit of low carbohydrate, high protein diet versus, typical low fat, high carb diet. And whether you look at outcomes like cholesterol, definitely sugar, most part weight loss, it was usually better. The only parity, I mean, if you decrease here, I remember one study where if you took 800 calories a day, it didn't matter what the composition of diet was. You just lost weight the same way. But it's 800 calories. It's almost starvation. You can't sustain that. Definitely not long term, right? Yeah. So, and this was the first kind of interesting red flag, right? Like, why are all these esteemed, societies, whether it's American Diabetes Association and all the expert opinions and American Heart Association, why are they recommending things that are on their face are not correct? Definitely besides weight, my interest was diabetes. Well, the question kind of remained unanswered. We could talk about corruption and involvement of
that's a whole other podcast.
Right, we're not going to do that. But it clarified for me that what I'm learning is great, but not necessarily sufficient. Mm-hmm. And so, and then as years go by, kind of confirmed. And then COVID was a very interesting period, as I'm sure everybody knows. A lot of things came to the light that were revelatory, let's just say. And so in parallel with that, I was taught to spend time with people. As I remember in medical school, in the lecture on physical examination, the chairman of surgery, and the shocking thing was that the surgeon was lecturing on how to examine a patient. And what stuck in my mind, he said about 70 to 80% of diagnosis is talking to a patient. And the rest, blood work, examination, yeah, it's fine. But you need to talk to a patient. And throughout the years, it completely panned out. And this is what regular insurance model simply does not allow you to do. There's just enough time, and especially with electronic medical records, which I don't have, the luxury that I can afford being self-employed. So I, on one hand, realized the deficiencies in training, the deficiency of the insurance-based model. And then I started hearing about alternatives, and the initial knee-jerk reflex, like just dismiss that. It's just hocus pocus, right?
Right.
But I kept hearing it from people that I respected, and so one day I decided, okay, let me look into it. And what I saw looked very promising and interesting. So um, last year, I took the entire course. It's 7 modules in functional medicine. It's called Institute of Functional Medicine. Completed the course, and what I learned was a tremendous amount. Oh yeah, and going back to COVID, I realized, again, reviewing the literature, that a lot of things that I considered were, probably useless, like vitamins and supplements and botanicals and things of that nature, are very, very useful and scientifically proven to be so. So that's something they don't, well, I don't know how it is now. I doubt anything changed, but that's something they didn't teach you in medical school or residency or fellowship. That's something that I had to discover. So when you put it all together, I realized that there's a whole area in my education that left unaddressed. So I covered that deficiency. And now that I've had it behind me, there's still a lot to learn. And it takes years. But what I'm hoping to offer my patients is a little bit of both. I want to create a hybrid where I take my training in endocrinology and laboratory science and all the knowledge that comes with that and combine it with additional level of knowledge and science, and that is everything that's not just traditional medications, but again, probiotics, vitamins of specific tailored nature, additives, and natural substances, diets, and everything else, and time. Because, with the practice that I'm opening, it's not going to be insurance based. It's strictly fee for service, so that I can actually spend time with people and talk to them and address all of their concerns. One thing I really like is to educate people, answer their questions, explore things together. I encourage people to come back to me with questions they read online. I can offer a different look at things because most people do not have training or expertise to evaluate a statement that they read. I can, and I can explain why at times what they read is incorrect, or why it is correct, because I have the background in that. So this is where kind of my evolution took me.
Yeah, that's awesome. We need more people like you for sure. Um, I know that you do a lot of work with obviously, being in endocrinology, diabetes and thyroid, helping people with weight loss or hormonal imbalance. I want to talk about a topic that I think nobody's really talking about, and that is men's health, because typically men are like the last people to go to the doctor. It's usually
Right.
right, the woman, the wife goes or the girlfriend goes, and then it's kind of like, drags him along, especially with more types of like functional medicine or what I'll say alternative medicine types of treatment. But there's a lot of, I think, um, question or um, just people not knowing about how do you treat men's health from the standpoint of hormone replacement, whether that's testosterone replacement or other types of hormones for men. So let's get into that, because I think that that's a really valuable conversation, to talk about. And it's funny, I was telling you before we started this podcast that there was someone who had just asked me about that, like looking
Mm-hmm.
for a doctor that is a traditional MD, but also doing, this kind of work with men's health. So I guess the question is, what would you do? What do you do differently, I guess? So let's say like a guy goes to his regular, GP, I guess it would be, right? And he's, older and maybe having weight gain issues or fatigue or even ED or like kind of the whole gamut. Where do you start with a guy like that that comes into your practice?
Well, as always, it starts with a very long and detailed conversation. On that, again, that right off the bat, that usually doesn't happen. Most primary care doctors would order just total testosterone, and not necessarily of the best available option, because there are different methodology as far as measuring testosterone. But again, the conversation starts with very detailed dive into what's going on, all the comorbidities involved, the nature of the symptoms. Sleep is overlooked so badly in men, and poor sleep deprivation are, is it's not number one, but it's a huge killer of testosterone level. It lowers testosterone like any stress would. Mm-hmm. So, I explore the symptoms. If it's ED, what happens if, either spontaneous erections at night or lack? Is there interest, lack of interest? It could be any combination. Some people have low libido, but erections are okay. In some, libido is okay, but erections are not. In a lot of men, it's both. Their weight, their eating habits. I mean, what people eat is just absolutely atrocious. People don't understand the connection, right? Yeah. So, it's not like we are Legos just consists of different parts. Everything in a human body affects everything else. Mood, stress. So things like you would not think to ask, like, what's going on at work. I had fairly young men, some are business owners, some work for somebody. They have, especially if it's construction or something like that, general contractors running their own business, they barely sleep. There's stress all the time, through the roof, right? I mean, that alone, even if you're otherwise healthy, I mean, think about it. If you're incurring financial losses, or your project is not going well and you're dealing with employees, and the last thing on your mind is going to be sex, most likely. Right. Yep. So, and that just goes undiscussed entirely. Sleep, stress, food, what people eat. You eat, what's called SAD, Standard American Diet, right? It creates constant ongoing inflammation. That's a big topic in the field of functional medicine. Inflammation, and specifically inflammation often caused by food. Well, inflammation starts in the gut and spills elsewhere. It affects everything else. It affects your brain. It affects your gut microbiome, which in turn affects everything else, including your mood, hormones, hormonal metabolism. Everything is interrelated. Are you obese? Or you're not obese? Do you have obstructive sleep apnea? That affects sleep. That affects testosterone. And then, of course, what are the goals? Because, again, it has to be differentiated. In some men, there's nothing wrong with their testosterone. So things that help in a kind of a mechanical way, like Viagra, Levitra, Cialis, they can do wonders, and they are much more effective, specifically for erections, for example, than any testosterone would, right? If there's testosterone deficiency, and they have two general categories. You have testosterone replacement. This is being technical, but if your testosterone is super low, just low, right? You need to replace it, you need to bring it back, versus what is referred as testosterone optimization, which is, it's not really low, but it's low-ish. Right. So you want to be higher. Right. That's a different animal. And one has to be clear about benefits, but also potential downsides in starting testosterone therapy. And taking one look back, very often you don't need testosterone. You need a medication that stimulates your pituitary gland. The pituitary gland is a master gland, sort of at the base of the brain, that controls all the other glands. And it's affected by higher levels in the brain, but also affected by stress and chronic diseases. So what often happens, it's not like your testicles are not working as a primary. Again, we're talking about root causes of functional medicine. Very often, the root cause is not below the waist. The root cause is here, right? And whether it's stress, sleep deprivation, chronic disease, bad relationships, you know. But if you're talking about chronic disease, very often in obesity and uncontrolled diabetes, it's the pituitary that suffers. And the best, most elegant approach is not just to smear testosterone on you, but to wake up the pituitary while addressing all the other lifestyle issues, lack of exercise, lack of sleep. Those things lower testosterone like crazy. Okay, so very often there's a very cheap and generic, widely available medication. Women use it to stimulate the cycle, Clomid. It can wake up the pituitary if the issue is there, and then your testosterone normalizes. And then if you improve your lifestyle, you can wean somebody off, because the disadvantages at times in starting testosterone, if you take it for a long time, it's very difficult to stop. And that is because once you start it, your own production goes down. And if you take it for a long time, your own production may be diminished for a very long time or forever. So one has to be careful in initiating therapy and discriminating. But of course, very often that's what you need, and then there's no problem. And then you decide what is the best method, the creams, the injections, which are, in my own view, not as elegant as other methods, but is a legitimate method. So all of that takes a long time to discuss and hash out. Interpretation of the labs, ordering labs at appropriate time. It has to be early in the morning. Ordering appropriate type of labs. All of that requires knowledge in laboratory science in endocrinology. So this is what I'm offering people, a much deeper dive than just a bro science. As very often men come with, a guy told me in the gym, takes this, and then he's just like turned into Schwarzenegger in his prime. Okay. Yeah.
So. Yeah, that's funny. So that's interesting. I didn't think about it from that perspective. So actually giving testosterone replacement can, lower your own body's natural production of that.
Yes, it always does.
Yeah.
Right. So you have to be careful with the dose, and you have to do it just right. Follow it carefully. Yes.
Right. Yeah.
It can be done, but it requires ongoing relationship and an effort. Yes.
Yeah. And interesting what you said about the brain, because I don't think most people would even make that connection that, oh, wait a minute, like the production is controlled by something in the brain, let alone your normal hormonal, activation that's normally happening in the body. But no, you're saying that the pituitary has a big impact on that.
No, it's an absolutely fascinating thing. It's an evolutionary adjustment. Like, for example, if you go through the ICU, people who are deathly ill, sepsis, after a difficult operation, if you choose men and you test their testosterone while they're actively severely ill, virtually everyone will be low, if not frankly low, as in lower than lower limit of normal, much lower than their normal, usually frankly low. And that's just the body adjust. The body, when stressed, channels the resources to deal with that stress, right? If you're running away from a dinosaur, you're not thinking procreation, all right?
Exactly.
You need to save yourself, right? So adrenaline is released, all the fight or flight hormones are released. You're saving your life. That's what testosterone, you just don't care, right? So this is an extreme example. And then when people recover, testosterone recovers as well. So obviously people come to me, they're not straight from the ICU, but chronic stress, people don't realize, does the same thing, maybe not to the same extreme degree, but still. I had a patient just yesterday, he was about 6 feet tall, 260 pounds, fatigue, lethargy, ringing, total testosterone about 90. This is lower limit of normal, 250, like frankly low. And it took him years. Finally, his wife convinced him, look, you got to eat well, you got to take care of yourself. So he starts eating well, he loses 70 pounds, which is kind of like almost bariatric surgery type achievement.
Yeah.
He goes to the gym, his testosterone almost normalizes.
Wow.
Right? it goes to 256. It's still lowish. He slacks off, it goes down a little bit. You could see the trend. Like he comes with all this information, and at the end of the day, when he slacked off and he dropped a little bit, he goes to one of these low T centers. What does he get? At $700, per quarter, testosterone injections, right? And now he's over-replaced, right? And he's not even much better off. So instead, in this case, again, you need to stress the importance, which he already demonstrated, of sleep. Oh yeah, he had obstructive sleep apnea, which went away after he lost weight. So everything improved. He doesn't necessarily want to be in testosterone. He is a perfect candidate probably for Clomid to stimulate his pituitary wake up, coupled with diet and exercise. He will normalize his testosterone, as I'm sure will happen. So not every case is like this. Some men definitely do need testosterone. But again, you need to discriminate. And most people just don't.
Are there any side effects from that medication?
Breast tenderness at times, maybe a little bit. Those nothing to write.
Nothing major.
The dose that's used is much lower than women. And it's every other day because you need to stimulate pituitary in a pulsatile fashion. And then, so it's like half of a minimal dose every other day. And then you start weaning off if people, change their lifestyle. I weaned off several men and they just continue being normal. The foundation, though, is diet, exercise, sleep, relationships. None of those things are addressed when you go to a low-T center. That's not a business model. The business model is sell you testosterone. So anybody who walks through the door will end up on testosterone because that's how the money is made. There's nothing wrong with making money. I'm all for making money, but the question is how.
Right. So. Yeah. So obviously, you would work with someone on their nutrition, better sleep habits, reducing stress. What about supplementation? Are there specific supplements that you typically like or use in this case?
Well, it depends. There are supplements for sleep, and a lot of them are magnesium based. There are supplements that help falling asleep. There are supplements that help for people who fall asleep okay, but wake up. And then there's both. But of course, you need to discuss the sleep hygiene as such, which no one does, right? If that's an issue, we talk about, what's the best strategy, how to wind down before you go to bed. I mean, people are on the phone all the time and watch, the latest tweet or whatever, you get crazy. There's no way to take care of your health, right? Especially if you keep waking up. That needs to be addressed. Some people need antidepressants, although that I don't usually go to that. I think people are really overtreated in that respect. There are definitely ways to treat it. And then there's ashwagandha. There's other things that help with stress and help you to relax a little bit. But just mere talking about it, very often a light bulb comes on. And, if you stress it several times, people get it. And if they want to help themselves, they will do something. It's just that conversation doesn't take place in a typical low T center.
Right. Yeah. And what are the blood tests that you do? I mean, you were mentioning earlier that most people just look at total testosterone. Well, obviously it's more in depth than that. So what do you look for? Well,
the bare minimum is total testosterone by mass spectroscopy, which is a gold standard. It's the most accurate way to, it has to be done early in the morning, around 8 or so. Free testosterone, because biologically speaking, what does the job is not total. Total is just a reserve, right? But what actually does the biological function is free testosterone. And the difference is total testosterone is attached to a protein, either albumin or sex hormone binding globulin, which I also measured. And when it's attached to the protein, it doesn't do anything. It just sits there. It's the one that's free floating, unattached, that matters. Just so that you understand, the concentration of it is 10 to the minus 12 for free, which means it's 1 in a trillion. Now imagine trying to measure a substance that's a few particles out of a trillion. You need the best equipment. It has to be done by mass spec. Very often it does it's measured by a different assay, not nearly as accurate. Sex hormone binding globulin, free testosterone, total testosterone, LH and FSH, the pituitary hormones. You need to know where is the primary problem. In the testicles, in which case the pituitary hormones are elevated, or in the pituitary, in which case they're not. They're quote unquote normal, but there's nothing normal about that, or actually low. So you need LH and FSH. You need to check prolactin, which is a hormone that creates milk in the breast, and the men should not be elevated. If it's elevated, it's sometimes a cause of low testosterone. So these are basically the bare minimum that you need to do. And sometimes you need imaging if it goes that way, as in, it could be a tumor of a pituitary, never cancerous, but nonetheless, something disrupting pituitary production. So yeah, all of that has to be addressed. Some medications can cause prolactin increase. Those need to be addressed. It's both art and science, is what it is.
Yeah, I mean, so many people now are on, statins or high blood pressure medication, like all of that stuff.
It's an epidemic. Psych meds. It's just.
Yeah.
Yeah.
Yeah. Well, this has been enlightening. And I love what you're doing. Like I said, we need more traditional MDs that are looking at, treating their patients from a more holistic, whole body, what is the root cause type of perspective versus just, okay, come in, spend 5 minutes, and I'm going to write a prescription.
Right.
But yeah, and that's the big difference with what you do. I mean, when someone comes to see you, they're going to get time, and you're going to ask a lot of questions, and you're going to cover like a lot of lifestyle things that the traditional doctor, by no fault of their own, just doesn't have the time to do. That's the bottom line.
Yes. And a lot of doctors are simply not equipped. A big part of endocrinology training is understanding and interpretation of labs. A lot of doctors take labs at face value, literally, like it's a word of God. But what you don't know is how the sausage is made, and you need to know how to interpret labs before you, issue an advice. It's a very important part of traditional endocrine training. I'm very thankful for that. So
yeah, for sure. So again, you're located in Fairfield, Connecticut. Your website is www.restorehealthmd.com. And any other way that you would like people to get in touch with you, go to your website or
website is a good site. Just call on the phone and schedule an appointment. I'm probably going to start seeing patients sometime in April because it's literally just getting off the ground. The number is 203-760-5544. 760-5544. And come on in and we'll have a meaningful conversation.
I love it. Well, thank you for your time and all this great information.
Thank you very much, Dan.
Yeah, of course. And thank you all for listening. And hope everybody has a great rest of your day.
Thank you.